All right, recording in progress. Yeah, today I'm just going to interview one of our first Kandyway users. Her name is Amelie Mongroin. We've been friends for a long time, and she was one of the first, besides my wife, to start her treatments. And my wife saw amazing results, and I reached out to Amelie, and I asked her, hey, you give this a try. I think it's going to help you out a lot. So this is just a little bit her story. And can you tell us about kind of your skincare routine and how it was before Kandyway? And
Yeah,
yeah, let's just start from there. Just supernatural, and we'll go with the flow.
thank you, Yannick. Yeah, I'm happy to do this with you. So, skincare is always something that I think every woman and every man is looking into at one given point in their life. And for me, it was a lot of cream, a lot of trying to understand how to reduce those wrinkles. Even though I do love wrinkle, I start to realize that I look older than I would like to look like. And what to trust on the market is very difficult. And definitely, I'm not into surgeries. I'm scared of Botox. All of these things that you see. And I was really looking for something easy, and that you can also bring with you when you're traveling and so forth. And I was really.
What was your biggest concern? Like where you said you started to look old because you hit your, can I say your age or no?
Yes, you can. I'm going to be 50 next month.
Yeah, I called her 50 plus and she was not happy with me. So I had to backtrack to 49.
Definitely. Yeah, well, it's really around the eyes. Me, it's my eyes that I noticed that the wrinkle and my eyelids are kind of dropping also.
Mm.
And I feel that it it really ages me. And I never thought that I would be this person that think of reducing her wrinkles and so forth, or just giving a nice, a better life to the skin also.
Because you
And
were also super scared of any type of surgeries or Botox or all that stuff. You said you'd
no,
never.
definitely, and I still will not, right? I still will not do that. And also, we there's spots that kinds of appears too, right? Like
Mm.
blemishes or darker spot that I have right here. So these were my worry, and it's not enough to cover this with makeup,
Mm.
You
But
would like to
what
see what.
when I told you that developed a red light therapy mask, we just got the FDA approval. Actually, it's not approval, it's clearance, FDA clearance. Just so everybody knows, there's a difference between approval is for vaccines
Mm,
and medicines. Clearance is more for devices. So it's like a class
okay.
2 medical device. So that's people get confused with the word because they've heard approvals for COVID for the last 3 years. So it's clearance. And when I said I had this mask and it was red light therapy with red and near infrared light, and you should try it. What did you think originally, and what kind of research did you do?
Yeah, I was actually very curious,
Mm.
because I had read about red light therapy, mostly about night shift that you would work during the night and you need to clear your vision and so forth and get your right sleep.
Mm-hmm.
So I knew it was something that
So
was
you knew that it helped with sleep patterns as well.
exactly sleep
Yeah.
pattern.
Okay.
So then, trusting you and what you have done in your career was one thing too, huh? But so when you brought the mask, I thought, why not? Let me try that, right?
Mm.
So to me, it was almost a no-brainer, because I had read a bit about it, but I had not known that it could do something about your skin.
Mm.
So to me, it was, why not try that?
Do you so it was really your wrinkle, right? Do you mind if I show it?
Yes, of course. I don't mind.
Okay, well, you gave me the picture and said use it.
Yeah.
You're a little reluctant, but so I just want to show the picture to everyone. Can you see the screen, Emily?
Yes, I can see your screen.
Okay.
Woohoo.
Okay. So here, oops, I'm going to hide this. Okay. Yeah, so it was really around here, the eye wrinkles. Is it mostly at the, can you explain this picture a little bit?
Yeah, yeah. So basically, it's exactly what you see. You see how underneath the eye, it's kind of wrinkled, but also a bit puffy. Huh? It seems puffy, and that's where I felt that, oh my God, it's droopy, and I feel that I'm much older than I am, and it was starting to bother me a lot, actually. And on
And
that picture, can also see that I have a bit of makeup on, right? So it's not like, so the makeup does not hide all of this, right?
yeah, and how long? So can you tell us how do you use the Kandyway device, like yourself? Everybody's
Yeah,
kind of using it in the morning, night, different type. What did you do to achieve these results?
yeah. Well, so I did follow
I'm going to stop sharing now so we can see your
yeah. So
younger face.
I did follow the instruction of doing it for 4 weeks, doing it every second day, while or 3 times a week, something like that, right? So I was quite good on doing that, and it's only 10 minutes, first of all, and so I would do it in the morning. I would do it in the morning, wash my face, and just put to I had my coffee first, and then after my first coffee, I would put it on, and I would just take the time to absorb it, and just before my day start. And it was such an easy way. And also the way that it's made, the mask, is that the timer is already set in. So we don't have to worry to set the timer if you leave it too long or whatsoever. So it's basically putting it on, taking 10 minutes off your day, and then taking it off, right? So I saw results after the first week, for sure. Okay. But it's really after that 4 week period that I really saw, I said, oh my God, okay, that's before and after. Because, when you see yourself every day, you don't see immense change. But when you see a picture from 4 weeks ago and then the next one 4 weeks later, then you say, whoa, okay, this really, really helped.
When did you start feeling like you're like, is this like in the beginning? Did you say this is working, or you were just like, I'll just keep going with it? And what did you feel like after 1 week, 2 weeks, 3 weeks, and so on? What did you experience?
Well, so one thing that I noticed, it was always the second day. Like I would do it the first day, and it's always the second day that I thought that my skin was more radiant and less droopy. I don't know why I use this word all the time, but droopy meaning that everything is falling.
Saggy skin. Yeah.
And it was always a second day. So to me, it was like, oh, okay, now I know that that's what's going on. So I had the feeling that something was working, right? And then, of course, like anyone that is not very disciplined, I could sometimes skip a few days. I was not doing it every second day. And then when I would do it again, I would see that it was coming back to where I left it off, right?
Yeah.
So yeah.
Yeah, because the before and after, especially the eye wrinkles, that's quite amazing. Because I lost touch when you went to see your parents and stuff like that, but you stopped for like, was it 10 days or something, and then you picked back up, right?
Yeah, exactly.
So
And
those pictures, is that like a total of about 4 weeks, like 12, 15 times doing it?
Yes, I would say definitely a total of 4 to 5 weeks. Okay. And I would say that within that time, I did it at least 2 times a week. All right. And mostly like, so I did it all the way to 10 times, I would say.
And you didn't, I know I didn't get you any of the hydrogel masks. You only used the mask once because you didn't have any, right? So those results are purely based on the red and near infrared light.
Yeah. Yeah.
And what do you put on? So you clean your face, you do it for 10 minutes, and what do you put on your face after you're done, or you just kind of leave it?
Well, I leave it, and that's me. I leave it for a good 30 minutes, and then I just go to get to my routine of doing my washing my face again, putting my cream, and then going off to what needs to be done for the day.
Yeah, you mentioned now. How did it make you? We saw kind of the outside results, but how did it kind of make you feel?
Inside.
Inside, yeah. I guess there's external and internal feelings, right?
Yeah, well, to me, and it's nice that you asked that question, because of course you feel much better. You feel much better inside because you feel that it's healthy and you are making yourself better, right? And you feel like dressing up a bit more. You know, it just kind of gives you a bit more of a positive energy, I would say.
You do look younger though. I could see it from like a few months ago. You look good.
Thank you. And I always take those compliments.
Yeah, no, for I guess for a woman that's only 49, you look really good.
Thank you.
I'll talk to you in a couple months, see how you feel.
Yes, with my new age, right?
Well,
thank you.
Yeah, anyways, that's amazing. And what do you plan on? So how often do you use it now that you've kind of gotten the results, like pretty good results? What's your plan now?
Well, I still do it twice a week. I think
Okay,
it's
you're like maintaining.
yeah, because and especially now that I saw this quick result, I'm thinking that if I keep it on a routine of at least twice a week, then my spots probably will diminish, right, over time.
Yeah, that's
So
happened to my wife. Yeah.
I'm more into that now, just to make sure. And hopefully, and I would like to read more about it, but hopefully there's a long-term health result, right? Because I think it's supposedly proven that red light therapy is good for your. So I want to read a bit more on that, and if ever you do have more blogs about your red light therapy, that'd be really cool for everybody to.
Can you? Where did you get the best information, and what is this guy's name again? If anybody wants to go on YouTube and listen to him, because he's like me. He's like this big burly guy, but he's extremely smart. He's a neurologist, right? And
yes.
Can you tell the name?
Yeah, his name is Andrew Huberman.
He was on Joe Rogan, I think, once too.
Yeah. Yes. Now he is, and what's cool about this guy, and of course I speak highly of him, is that he is a scientist, but he's bringing topics for us to really understand, and not in jargon that is very hard for us to figure out. But at the same time, it's like going back to school. You really have the knowledge once you listen to his podcast. And so it's worth just hopping into and just searching red light therapy. And just go and
just so for everybody knows, on the most simplest terms, why this actually works. It's because as we age, the collagen in our skin deteriorates. And as the red and near infrared light penetrates our skin, it helps activate the production of collagen and elastin. So it makes total sense. It's not a cream. It's not nothing like that. It makes total sense. If you can reactivate the collagen production, you will get some skincare benefits from that. It just makes your skin a little bit more youthful, more radiant, and gets rid of some of those conditions that come with aging. Our age.
And you don't have to inject anything in your skin.
Yeah, no kidding. Okay, Emily. Well, it was wonderful, and thank you for taking the time to share with everyone your kind of story and just be real about it.
Anytime, Yannick. Anytime.
Okay. Thank you. Have a great day.
You too. Bye.
Bye.